Cannabicramine, known as CBC, is the third most abundant cannabinoid found in the cannabis plant, after CBD and THC. As the mother of all cannabinoids, CBGA matures, the enzymes convert into the raw cannabinoids CBG, THCA, CBDA, or CBCA. Through the process of decarboxylation, the A's fall off to become THC, CBD, and CBC, by removing the carbon dioxide atom from the organic acids. So, what is CBC and why are we just now hearing about it? While THC and CBD are the most well-known cannabinoids, there are over 120 others that have yet to be fully studied, and more are being discovered as research continues. Of the known cannabinoids, CBC is a minor or rare cannabinoid, meaning cannabinoids that are produced in smaller amounts in the cannabis plant. CBC, like CBD, is non-psychoactive and does not produce a high. But unlike THC and CBD, CBC does not bind directly to the cannabinoid receptors in the brain but instead works by enhancing the effects of other cannabinoids, particularly THC and CBD. The endocannabinoid system is a complex system in the body that regulates a variety of functions, including pain, mood, appetite, and sleep. It's composed of endocannabinoids, receptors, and enzymes that work together to maintain balance and stability in the body. So, how does CBC fit into all this? Well, like other cannabinoids, CBC interacts with the endocannabinoid system by binding to cannabinoid receptors. Unlike THC, which binds directly to the CB1 receptors in the brain, CBC does not bind directly to either the CB1 or CB2 receptors. Rather, it primarily interacts with TRPV1 and TRPA1 receptors, which are involved in pain and inflammation perception, and it also enhances the effects of other cannabinoids through the entourage effect. Anti-inflammatory effects of CBC were first reported in the 1980s using a rat model of edema. High doses of CBC were more efficacious than the non-steroidal anti-inflammatory drug known as NSAIDs. Further, CBC has been shown to reduce pain and inflammation associated with osteoarthritis in rats without the negative side effects of NSAIDs. Like other synergistic actions of cannabinoids, CBC has a greater anti-inflammatory response when combined with delta-9 THC than when either cannabinoid is used alone. An anticonvulsant, also known as an anti-epileptic drug (AED) or anti-seizure medication, is a medication primarily used to prevent or treat seizures, particularly those associated with epilepsy. They can also be used to manage mood disorders like bipolar disorder and to treat nerve pain. The strain Charlotte's Web, while renowned for its high CBD content and low THC levels, also boasts significant levels of CBC. This combination of CBD and CBC is thought to contribute to the strain's overall therapeutic potential, particularly in its treatment of Dravet syndrome, a particularly severe form of epilepsy that typically begins in infancy, characterized by frequent and prolonged seizures, often triggered by fever. CBC exhibits antinociceptive properties, meaning it can reduce or block the sensation of pain. Studies suggest that CBC's pain-relieving effects may be mediated through interactions with CB1 receptors, TRPA1 receptors, and the adenosine A1 receptor. It has shown promise in reducing both acute and chronic inflammatory pain, as well as neuropathic pain. Several studies have examined the impact of cannabinoids as antibacterial and antifungal agents, especially in light of the need for the development of novel antimicrobial agents due to increasing drug resistance. Of the cannabinoids tested, CBC has been found to be one of the most effective. CBC's mood-elevating properties are about 10 times more effective than CBD, making it a promising cannabinoid for reducing stress. CBC raises the brain's bliss molecule anandamide, a chemical that affects mental health. Anandamide is a neurotransmitter belonging to the fatty acid derivative group called N-acetylethanalamine. It's the first endocannabinoid discovered and plays a role in the body's endocannabinoid system. The name anandamide is derived from the Sanskrit word ananda, meaning joy, bliss, or delight. Many of us are probably familiar with research involving chocolate and how chocolate consumption contributes to the feelings of happiness and relaxation. Chocolate provides a direct, albeit minor, source of anandamide and substances that slow its degradation. CBC may boost anandamide levels indirectly through its interaction with the endocannabinoid system, potentially offering more pronounced and longer-lasting effects than chocolate alone. Studies indicate that CBC can regulate the expression of TRPV1 and CB2 receptors, potentially leading to cancer cell death. Along with other cannabinoids like CBD and THC, CBC has been found to inhibit the growth of certain cancer cells. Research suggests that CBC can inhibit the growth of various cancer cells, including those from breast, gastrointestinal, and head and neck cancers. Years of prohibition has resulted in cannabis research still being in its early stages. Therefore, while progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions, as it may interact with other drugs, particularly those affecting the central nervous system or metabolized by the liver. CBC may enhance the effects of blood thinners and sedatives, and it could potentially alter the effectiveness of antidepressants and immune modulators. Thank you for joining us. If you're still with us and willing to go deeper into the weeds of cannabinoids, as we continue to explore the most common cannabinoids found in today's cannabis market, hit that like and subscribe button and leave us a comment. Until next time. Peace.